Have you ever heard that someone is pregnant and they don't know that they're pregnant until they're in labor? Yes, it is possible that someone can get pregnant and they don't know that they're pregnant until they are in labor. So that is what we are going to talk about today. So the whole thing, how I've described it, what is it? It is known as cryptic pregnancy. Have you ever had something called cryptic pregnancy? So what is cryptic pregnancy? And before that, so guys, if you're new in this channel, please kindly consider clicking that red button, give me a thumb. Also make sure you turn your notification bell so that every time I post a video, you will be the first person to be notified. So let's go straight away to what is cryptic pregnancy. So cryptic pregnancy is when a pregnant woman does not know they are pregnant, and in some cases a person only realizes they are pregnant when they are in labor. Maybe you are in a labor ward as a nurse or as a midwife. A person has come or a woman has come for you to do for maybe for pelvic exam or vaginal examination, because of that experiencing unusual things. That is the time you will realize that this mother has the labor has begun. So most people realize they are pregnant somewhere around 12th week of pregnancy, and this could be because they have symptoms of pregnancy or because they have missed period. We are going to see if in this cryptic pregnancy, do someone really miss a period, or when they are pregnant they can still have menses and they're pregnant. We're going to look at that. So let me say something. A positive result on a pregnancy test can confirm that you're pregnant. So with the cryptic pregnancy, nothing trigger a person to believe that they are pregnant. This could be because they don't have any symptoms of pregnancy or any mistake or maybe they mistake symptoms of pregnancy as a virus, or maybe they're having some conditions, or maybe their pregnancy test were wrong. So let us look at who is at risk of getting cryptic pregnancy, and why would this person be at risk of getting cryptic pregnancy? Because not every human will experience a cryptic pregnancy. And this is because if you are pregnant, the first sign is that you will lose period. We want to look at who is this cryptic pregnancy is mostly likely to happen to. So anyone can have a cryptic pregnancy. Any woman, if you are in your reproductive age, that is 12 years to 45 years, you can have a cryptic pregnancy. But you can be at a higher risk if you are in this category of people. Number one, if you had maybe recently given birth. Let us look at the reason why. Maybe you might not know that you are pregnant and you have just given birth. So after you have given birth, it may take several months for your period to return. Yeah? And you may not ovulate if you are breastfeeding. This can give people the false impressions that you are completely safe from pregnancy. So it is difficult to predict when you are ovulating during breastfeeding and when you had returned to your fertility phase again. So this one will answer our question that maybe you might ask during this video. When you're watching this video, when you are in cryptic pregnancy, you will not have periods. yeah, you will not have monthly period, because pregnancy, there is no time you are allowed to bleed. So remember, we usually say that when we are breastfeeding, you can use breastfeeding as a method of family planning. And remember, all these types of family planning, they usually have 1% failure rate. So you might be using breastfeeding as a method of family planning, and you think that you can't get pregnant, and maybe you during that time you have started ovulating and you didn't know. So you might get pregnant without knowing, and maybe this your pregnancy might not have any signs and symptoms, and this will not even trigger to your mind that you are pregnant. So if you did not have any signs and symptoms of pregnancy, you know how these signs and symptoms, pregnancy symptoms, can make someone lose even the mind. If you don't have them, you can just carry pregnancy safely up to the time you are in labor, or maybe you will realize later when you are term. Number 2, who is at risk of getting cryptic pregnancy? Another person who is at risk of getting cryptic pregnancy is someone who is having polycystic ovarian syndrome. Polycystic ovarian, if you don't know anything about polycystic ovarian syndrome, kindly go and watch previous videos. I had done a video of polycystic ovarian syndrome, so go and watch and know more about it. So what I want to say about polycystic syndrome, people with polycystic ovarian syndrome have periods that are unpredictable. These people can take 1 year before they see their menses. They don't know if they are, they just imagine that women usually ovulate. They don't know when they ovulate. They don't know when their periods will come. And because they usually skip periods in normal days, when skipping periods is a normal thing for them, they may not realize they are pregnant if they miss period. And I said, remember, most of this cryptic pregnancy, sometimes they don't have symptoms. So this person might carry pregnancy up to term without realizing that they are pregnant. Or maybe they might go to labor and find out they're giving birth, which is very funny. I don't know, but that is what it is. Another group of people who can have who is at risk of getting cryptic pregnancy are those who are using birth control. Yes, people who use birth control may mistakenly think they are protected from pregnancy, and therefore even when you use it correctly, there are small chances of failing, and these small chances of failing can happen to you and you get pregnant. And if you're pregnant, it doesn't have any symptoms, you might carry the pregnancy up to term. You go to labor without knowing that you're pregnant. You go to labor, you sit on that delivery bed, and then you realize that you are giving birth, which is funny. Yeah. Another thing that also another group of people who are also at risk of getting cryptic pregnancy are people who are in their pre-menopause. People who are in their 40s think that they are too old to get pregnant, or mistake pregnancy symptoms for menopause symptoms. Yeah, we know we have some menopausal symptoms. I will talk about them. I don't know if I've done a video about that, but I don't think so. I will talk about menopausal symptoms so that you know. So they might think that they're too old to get pregnant. They can't get pregnant. They will just enjoy sex, and then on the way they get pregnant. Or maybe they might think that those pregnancy symptoms are menopause symptoms, so they just ignore and continue living until they are in labor. Is when they realize that I'm giving birth at 40, at 50. Okay, another group of people who also are at risk of getting cryptic pregnancy are people who have never been pregnant. If you know you have never carried a baby, and maybe your pregnancy when you got pregnant or when you became pregnant, you did not have any symptoms. If you have never been pregnant before, you are less likely to know what it feels to be pregnant. So this means a pregnancy could go unnoticed for a longer period of time, and maybe until you are in labor. So let us answer this question. Will a cryptic pregnancy show a pregnancy test? Will a cryptic pregnancy show on a pregnancy test? You should still get, you should still get a positive pregnancy test with cryptic pregnancy. However, using this home test result may give you false negative results. So if your symptoms doesn't agree with home test results, you should consider, if you don't agree with home test result, or you doubt home test result, you should consider going to the healthcare provider so that they diagnose it well. Do you get your period when you are having a cryptic pregnancy? The answer is no. If you're pregnant, bleeding is a danger sign in pregnancy. You should not bleed when you are pregnant. So with cryptic pregnancy, the answer will still remain no, because you are at any point you should not bleed. You should not do what? You should not have your menses. So you might have implantation bleeding, which is just spotting, or maybe you might have abnormal bleeding during pregnancy, which is also not something that is usual. So it will alert you and you should go to the hospital. But if you don't have this unusual bleeding or implantation, whatever, you are good to go until you are at term, is when you will realize that you are pregnant. So let us look at the signs and symptoms of cryptic pregnancy. Before that, what causes a cryptic pregnancy? There are several reasons why a person may not realize they are pregnant. Some of the causes are: you do a home test result with salt and urine, you will get a negative false result. Another thing is that when a person doesn't have pregnancy symptoms, you will carry the pregnancy up to term. You might think that you are just having another condition, or maybe you are just adding weight, but in real sense you are pregnant. A person doesn't notice the pregnancy symptoms or dismiss them. That is also some of the causes. A person doesn't know the symptoms and therefore don't know they are pregnant. Let us look at what are the signs of cryptic pregnancy. People with cryptic pregnancy have the same symptoms with the normal pregnancy. The key difference is that the pregnant person don't realize a pregnancy is causing these symptoms. For example, they might think they are nausea because they have eaten some food, or they are tired because they need more sleep, or they have just worked hard during the day, or they just need to have some rest, or they might think these pregnancy symptoms, they can cause some symptoms that are related to other conditions. So they may relate these pregnancy symptoms to other conditions and maybe just assume them. So some of the signs are missed period. Of course, that is common, and we have said that you see most people who usually get cryptic pregnancy are those who are mostly breastfeeding using birth control and polycystic ovarian syndrome. And you see this group of people, they usually don't get monthly period daily, every month. So it is very hard for them to realize that they have a pregnant. And another thing is that maybe spotting, which is normal in pregnancy because of the implantation, and also false negative test results. weight gain or swollen belly is also another symptoms. And then fetal movements. Oh, let me say something about this fetal movement. Most people don't feel the fetus move until about halfway the pregnancy, until they are halfway through the pregnancy. If you have, if you have an anterior placenta is situated on your anterior, on the anterior part of the uterus. The placenta, this will make for the patient or the woman not to feel the kicks or the movement of the baby, because the baby is what? The baby is behind the placenta. So in the case of cryptic pregnancy, this could be why they don't realize they are pregnant. And also these people, they not knowing symptoms of pregnancy, you are young or have developmental disability, you may be unaware of common symptoms of pregnancy like missed period, tender breast, and nausea. So how long does cryptic I'm saying, how long does a cryptic pregnancy last? Most people realize they are pregnant about 20 weeks in the pregnancy. However, a person can be unaware they are pregnant until they are 40 weeks, until they are in labor, until they are in delivery bed. There have been cases where a person goes to the emergency room with pelvic examination only to discover they are in labor. So that is what it is. So how do you diagnose a cryptic pregnancy? How? Maybe you are a nurse, you are a doctor, you are a clinical officer, you have a patient who has come to the labor for pelvic examination. How will you know that this person is having cryptic pregnancy? First diagnosis, we'll base it on history taking and physical examination. If you do your physical examination, especially abdominal examination, you will know that your patient is pregnant. But to confirm that, do an ultrasound and then blood test and also urine test. Management of cryptic pregnancy: if you realize that you are having a cryptic pregnancy, management is just the same as normal normal pregnancy. Another thing that I want to talk about, this cryptic pregnancy has some complications, and these are complications that come because there will be no pregnancy care. This person might not go even for antenatal clinic because they don't know they're pregnant. Sometimes these people are smoking, they are drinking alcohol, they are using bank. And you know, if you are using those alcohol, smoking when you are pregnant, they are harmful to your pregnancy. So you might get a baby with congenital disability because you did not adjust your lifestyle. Another thing that is also common, this cryptic pregnancy is it has higher risk of medical condition such as gestational diabetes and preeclampsia. You won't receive any care when you are having cryptic pregnancy, and therefore what do you expect? Any medical condition can arise. And also congenital condition can occur because the fetus is at risk of the fetus is at risk of congenital abnormalities because you did not receive genetic tests, or the evaluation that helped diagnose birth disorder were not taken into place. So I think we have answered all the questions about cryptic pregnancy. So guys, bye. Let's meet in the next video.